Hi, this is Aditya Sai Kulseti from Andhra Pradesh, studying in Pratima Institute of Medical Sciences, first year MBBS. Today I am going to teach about the most confusing topic over anatomy, that is the perineum. I am going to take a virtual tour of the regions of the male and female perineum through the genital systems. Through an vertical tour, it was going to clear all your imagination and doubts regarding the perineum. I am going to raise a topic which was doubt to many of the medicos, and especially the first year medicos can revise their topic of perineum in just 10 minutes in the later part of the video. And now we are going to see the perineum, the superficial boundaries among the male and female genital organs at the lower part of the trunk from the inferior view. This is the superficial boundaries of the perineum, forming the scrotum anteriorly in the male, and laterally it forms the medial side of the thigh, and posteriorly it forms the buttocks in male, whereas in female the anterior region which takes its boundary as mons pubis, and both the lateral parts or lateral sides are including the same as the male genital perineum, which was the medial side of the thigh, and the posteriorly it includes the buttocks. And in between this video we are going to see a main important structures related to the perineum, deep boundaries on the structures. Those were arcuate ligament of the pubic symphysis and the superior pubic ligament, inferior pubic ligament, which were hard to imagine. So we are going to take a virtual tour over this. Dissected model of the female cadaver, that is a virtual model. We are going an virtual tour over the perineum in this model right now. So the view of the perineum is generally observed from the inferior view in the supine position, or we can see the view from the anterior view from the lithotomy position. Yes, here goes the view of the perineum and the mons pubis of the female, and this is the pelvic inlet. We are seeing it from anterior surface. Yes, anterior view. This is the inlet of the pelvis. We are seeing from anterior view. That includes all the neurovascular bundles. So for the better understanding, I am going to remove all these neurovascular bundle along with the muscles of abdomen and lower limbs, and I am just retaining the. Now I am going to dissect some of the regions of the abdomen and lower limb, and also the muscles of the back of the abdomen, such that we can easily conclude the perineum region. I am going to remove the arterial system, venous system, and the nervous system of the abdomen, including the musculature of the abdomen. And also I am going to remove the GIT of the abdomen except the sigmoid until the level of the sigmoid colon, because to understand the regions of pelvic inlet and including the perineum itself. So I am going to remove the skeletal system and the neurovascular system of the back of the abdomen region, and also the neurovascular system. I am going to remove the neurovascular system of the pelvis, because to understand the contents of the pelvic inlet and the musculature of the perineum itself. Just to remove the bit doubt over these concepts, I am removing these structures, and the later part of the video includes all the structures of the perineum for its better understanding of the neurovascular supply. So I am also going to remove the neurovascular system, including the lymph nodes and the musculature skeletal system of the lower limb for the better understanding of the perineum from the inferior view. The perineum can be viewed from the inferior side. So I'm going to zoom in. It was a bit difficult to get zoom in. Yeah, I finally get it. The zoom of the perineum. Yes, the perineum has two triangles from the outlet from the inferior view. The triangles on the anterior side was the triangle itself on the anterior side is urogenital triangle, and its posterior side of the posterior aspect of the perineum includes the anal triangle. The triangles are named as respect to the contents of the triangles includes in both males and females. The urogenital triangle in males includes the urethra, and in females it includes urethra and vagina. And the posterior triangle of the perineum in females and males both together have a anal canal, and anal the GIT, which opens out as excretory system. And some of the structures I am going to highlight here is superior perineal muscle and center tendon of the the urogenital diaphragm, that is the perineal body, and the perineal membrane. It also includes the ischium of the pubic bone on the right and left side, and the pubis on the left and right side. I'm also getting to highlight the pubic symphysis of the pelvic bone and the ischiocavernous muscles on the superficial layer, that is on the first layer of the urogenital triangle from the inferior view, and the bulbous spongiosis on right and left side. And I am also going to include the labia minora and prepuce, the hood of the clitoris in female, especially vestibulum vaginae in female, and also the urethra orifice in female, and prepuce, again the clitoris in female. And I'm going to visualize some of the systems of the anal triangle right now. Those were which includes the anal canal and some of the corpus cavernous muscle, which includes the deep layer of the urogenital triangle, the rectum, which was the continuation of the anal triangle from the inferior, which was going to hide as the deep structure, but from the superior or anterior view we can conclude it as a superficial structure. So some of the muscles of the anal triangle are, we can conclude with the rectum and the anal canal, which was also known as pars analis recti, and the anal sphincter, which was the external anal sphincter, pubococcygeus muscle, ileococcygeus muscle, puborectalis, and coccygeus muscle, ischiococcygeus on the posterior aspect, and coccyx bone, and sacrum 1 to 5 levels, and the sacrotuberous ligament, and posterior sacroiliac ligament on the lower aspect, on the back of the lower trunk. And also here I am going to highlight some of the muscles which support the perineum but not takes part in its content. The muscles that support the muscle of the perineum and the structure of the perineum itself, or that lies on the lateral aspect, are superior ganalus and piriformis, inferior ganalus, ischium, and obturator internus, quadratus femoris. On the right and left side, these muscles are the same in both males and females. That the sides may be denoted termed as lateral sides. Obturator internus is the main muscle that supports the perineum, but doesn't takes place as direct content of the perineum. I'm going to zoom in some more to show some more structures. I'm going to dissect now from the structures from inferior to superior to view all the structures. I'm going to dissect the first of all. I'm going to dissect first the ischiocavernous muscle on inferior, and bulbus spongionius on the inferior itself, and vestibular bulb of lateral bulb, and corpus cavernosum on the inferior side, labia minora on the inferior side, prepuce hood of the clitoris, and the vestibule of vagina, and perineal membrane. And also going to dissect some of the structures which takes a deep transverse perineal ligament, and on the right and left vagina, and ileococcygeus, the part of the levator ani, and puborectalis, part of levator, and pubococcygeus on the left side. And also going to zoom in to see the structure of the pelvic outlet, which doesn't take part in perineum, although these structures may extend into the perineum as some other structures. Gives us the terminal parts of the excretory system and urinary and reproductive system, both termed as excretory and urogenital system. So those includes these structures which are going to imagine includes pubourethral ligament, which supports the urethra, and pubocervical fascia, and also some of bladder. Yes, some of the surface of the bladder is seen from inferior aspect, and a rectovaginal system, rectovaginal fascia not system, sorry, and obturator internus, endopelvic fascia, tendinous arch. And I'm also going to dissect some other structures such as bladder right half and inferior pubic ligament and the bladder left half. Such that some more structures you are going to visible. Pubocervical fascia is also removed. Rectovaginal fascia is also going to remove. And cardinal ligaments of the uterus are removed. And see, ilium, the male bone is also removed. And tendinous arch is also going to remove. And many other structures are visible from the inferior aspect of the perineum. Now the perineum is empty. Only the deep perineal transverse muscle is attached to separate the urogenital and anal triangles of the perineum. And from this view we are going to view the pelvic outlet and the structures of the pelvic cavity from the inferior view. Those are rectum, anus, and on the posterior side sacroiliac ligament. I'm going to remove it, and posterior sacroiliac ligament, and some of the structures like rectum, anus, and the bones and the such as sacrum and coccyx are also viewed from the posterior aspects, and the ligaments that are attached to the acetabulum around the acetabulum for the attachment of femur are also removed. Some of the structures are floating in air, thus it's shown to be vertical. And superior and inferior gemellus, which are the supporting structures for the perineum but doesn't take part in perineum, and articular cartilage for the femur. And I'm going to slowly remove all the structures forming the pelvic bone in two for the better understanding of the uterus and rectum, including the anum. So by removing all the structures we can gain some of the structures such as anal sphincters of internal anal sphincters and external anal sphincters are found in the former part of the video. Already we have seen it from the superficial layers of the perineum itself from the inferior view. Now we are going to, after removing all the structures, we are going to view clearly the internal anal sphincter and anal canal, central tendon of urogenital triangle, that is the perineal body. We are also going to view some structures which are miniature structures but we can't see in dissected body, such as great vestibular gland, that is Bartholin glands, females, which are floating in air as this is a Rochmal model. And see here, this is a urethral artery, which was a circular muscle from an inferior view, and we can follow the video. In the former sections of the video, we seen the perineum from the inferior view and the pelvic inlet from the superior and anterior views. By removing certain structures and dissecting the structures from the inferior side and from the superior side and from the lateral sides. In this video we are going to see the perineum I already dissected the lateral half of the pelvic inlet and the pelvic bones, pelvic set of bones and the perineum, such that we can conclude its divisions by layer from the lateral side. That is, we are going to see the perineum from the lateral view, that is this kind of view. And now I have labeled here the part 1, the part 2. The part 1 is the space or fossa between the urethra and the rectum, and the part 2 is the space between the rectum and coccyx. And these spaces are named as